Transcranial magnetic stimulation therapy. This may be a term that's new to you, or maybe you've heard it before. What we are going to do is I'm going to be reviewing what is transcranial magnetic stimulation therapy. What's kind of its backstory? What was it initially used for? And what is really the future for transcranial magnetic stimulation therapy? Because even if you're familiar with this device, most people are not familiar with what the potential actually is, especially when you start looking at the research of things that it's been used for. So when we look at this, transcranial magnetic stimulation therapy was originally used to really map out how parts of the brain were responding to stuff. And then the other part was it was used for depression, was kind of the original thing. So it's for treatment-resistant depression. Now, the way it works is it's got it's a magnet. It's applied transcranially, and it delivers electromagnetic pulses into the brain. Now, when you do that, you change the way your neurons, your brain cells are communicating. Based upon the programming of the device, you can either have your neurons or your brain cells to connect stronger, or you can make them connect weaker. Now, these terms, if you're looking fancy neurological, long-term potentiation, so we want it to be basically prolonged, right? We want it to be potent. That's what happens when you say, brain, we want you to be stronger. But on the other side, you can say, brain, I don't want you to connect as strong. So long-term depression is what the other term is. So this is really about inducing neuroplasticity changes in the brain is really the focus of transcranial magnetic stimulation therapy. Currently, it's most widely used, though, in the world of depression. There are things beyond that, such as anxiety, OCD, and other things that it's being used for, but depression is really where it got its start. And it did so through treatment-resistant depression, because if you've been on psych meds or know anyone who's been put on depression meds, the success rates of those are kind of all over the place. Some people do well and others get no response at all. So TMS therapy is a good way to do that. Now, there has been evolution of TMS therapy. Used to start off with what we just call repetitive transcranial magnetic stimulation therapy. This took longer to administer. So people were getting treatments for depression that could be anywhere from 30 to 45 minutes, depending on the manufacturer and the device that was used. Whereas currently, if we look at the research out of Stanford and we look at the most updated protocols using theta burst, you can actually get depression and anxiety treated in as short as 4 minutes, depending on the device that's being used. So the one that we use is 3 minutes on one side and actually 40 to 45 seconds on the other side. Now, obviously, there's setup time, which makes it longer, but therapy can go really, really fast to induce neuroplastic changes. Now, before everyone runs and says, ooh, wow, like this looks really, really good for depression and anxiety, I think we need to go back and realize that when we look at depression and anxiety, these are symptoms of neurological health. And there are a lot of things that do impact neurological health. So, for example, let's say you've got depression because you're in a bad relationship. Let's say you've got depression because the food you're eating is not healthy. Let's say you've got depression as a result of no testosterone if you're a guy, or hormone imbalances if you're a female. If those are the cases and you then try to use TMS to be the treatment, you probably aren't going to get the results you want. So the success rates really start going down. And this is where a lot of mistakes are made when new devices or new treatments come out for different things. They are ultimately researching it to say the efficacy. And based upon the protocols, you get about a 50% success rate. Personally, I'm seeing closer to about a 70% of individuals are noticing improvement with their depression or anxiety. And it's like, well, why are those better? Well, because in general, I'm not a big fan of just saying, come in, let's do this therapy. I want you to come in. I want to get your labs done because we know thyroid issues can impact depression and anxiety. We know anemia and B vitamin and iron issues can do it. We know blood sugar, right? We know prior concussions and other things, even in the past, can increase the likelihood of depression and anxiety. So it is really recommended that you get a more comprehensive initial evaluation. So that way, when you come into one of these treatments, you actually have a much higher likelihood of success because TMS therapy, while it's good, it's also highly repetitive. So we look at the latest research, it's 20 sessions daily. And so if you're going to commit 4 weeks of daily treatment, I personally think you should be getting a well-rounded evaluation, make sure everything is going appropriately. So that's really been some of the evolution with it. There's more evolution coming as a result through Stanford and then doing functional MRIs where they're looking at basically traffic flow between different parts of the brain and using that as a predictor of who's going to respond versus not. There's also new devices coming out. They're always updating the protocols. So they'll typically be doing the research on the older protocols first or the older way of delivering therapy. So repetitive, and then they'll go to theta. Some things repetitive still king, but a lot of them, theta has really taken over. And the good thing is because theta is able to be delivered quicker, that also allows things to become more price effective, right? It's not as pricey. Whereas if you're having to do the longer protocols, that takes a considerable more amount of time. So price has to go up as a result. Now, when you look at the research for depression with transcranial magnetic stimulation therapy, it's interesting what you see. Because when we look at depression, once again, it is a neurological based issue. It is either due to neural connection, so altered neuroplasticity, or it's due to neuroinflammatory changes. When they've looked at transcranial magnetic stimulation therapy, they actually find that it reduces the amount of inflammatory markers. So, for example, one of the markers they've seen go down is called interleukin 6. That's an inflammatory marker. So, it's pretty cool that by stimulating the brain, you can actually reduce inflammation. Now, that's not the only thing it does because it does, as we talked about, it does induce neuroplastic changes, either making the brain stronger, so long-term potentiation, or telling the brain to chill out, don't be overconnected, long-term depression. And it didn't take long when they were researching this, say, if this can induce neuroplasticity and it can change things, what are other areas that may be beneficial? If you were to go to PubMed and type in transcranial magnetic stimulation therapy, and then really pick any combination of diagnoses, you are probably going to find research. This ranges from autism to ADHD to OCD to restless leg syndrome to incontinence to strokes to Alzheimer's to Parkinson's to cerebral palsy, and the list goes on and on and on. One of the things you'll see, especially when you start reading more about these neurological based conditions, is the researchers will tend to poke at those who are using TMS because most people in the TMS world are not using it to the level that has been researched to be beneficial. So there are plenty of those with neurological based conditions that could actually benefit from TMS therapy. And it's not even being offered. And it's because for most people, TMS therapy is just pretty much traditionally in a psychiatry practice. And with that being the case, it's basically only being used for depression, anxiety, or OCD. And so this really prevents a lot of people from getting the care that they should because there's not enough awareness about what it could be doing, but also there's just not enough exposure on it either. Like you have no clue of what could be used. So when we look at transcranial magnetic stimulation therapy, it's important to realize that it is a great way to induce neuroplastic changes. It can be done over a short period of time. The results tend to be pretty effective and they can last. Now, if you look at the research, you will see that the results are mixed on how long it lasts and needing tune-ups. So So for example, if you're someone and you're seeing a provider who's able to bill your insurance, as long as you follow certain protocols, they actually let them do tune-ups every 6 months where they can actually have you repeat the whole thing. Now, obviously, most people don't want to repeat. So if those are the old protocols, it's actually 36 sessions. You don't want to repeat 36 sessions every 6 months. And this is where we have to realize that TMS is one of many signals to the brain to induce neuroplastic changes. And we don't want to make the mistake or be so naive. And this is not really about the patients, this is the providers. The provider shouldn't be so naive to think that simply administering TMS therapy is the only signal that's going to the brain and is going to change neuroplasticity. This is why, as we talked about at the beginning, everyone should have a complete evaluation, including their hormones, their thyroid, anemia, blood sugar, vitamin D, right? What about their nutrition choices, their exercise, their sleep habits, sleep apnea, and many other things? Because last thing you want to do is go through that much of treatment, spend the money, and realize that you weren't ever really going to get better, or you weren't set and you weren't in a place where you were going to get lasting results because they were trying to make it overly simplistic. I've seen this happen. Please don't do it, because it's easier and it's worth the money to do it right with your evaluation. So that way you get good results, because I've seen people go a couple years before they do TMS again, and others can go without ever needing TMS. But it's making sure that the right signals are being sent to the brain. So that way, the neuroplastic changes that you want made, you know what? They're being made. So at the end, TMS is something that many people should be considering for not only depression and anxiety, but to go beyond that. And it should be noted that if you have brain injuries, if you have POTS, dysautonomia, you've got severe neurological based fatigue issues, the newer protocols tend to do much better. They're not as long, they're not as aggressive, they're not as demanding on your energy. Some of the older protocols, especially at higher intensity, they do take a lot more energy from you, and they can make you worse as a result. And unfortunately, many of the people administering TMS, they are not equipped to treat brain injuries or the other things. So you may need someone there who can help coach along the way. Because once again, nothing in the body exists in isolation. And it's important that we understand that each part of the body connects with each other and influences the other. So I hope you found this useful as we have this discussion on transcranial magnetic stimulation therapy. This is something I wanted to talk about because I've used it for a few years now, and the results have in general been really good. But there's also things that need to be done to make sure it's more predictable versus a shot in the dark, because a lot of people are doing therapies because it sounds good, but there's not a lot of reason for them to do it beyond that. So there's not things pointing in that direction saying you were likely going to respond to this, or maybe you weren't. So I want to make sure people are not guessing. And that's part of why we do these videos and we have this podcast, is so that you get this understanding that the brain and body, it really does work together as a whole. And as you address the body as a whole, that is where the best results will always come. And as you get good results, then your frustration goes down because you no longer feel like you're guessing. Till next time, this is Dr. Z.